welcome to our Monday Minute. Today I want to discuss some clarifications that many have misunderstood regarding the calculation of the Patient Driven Groupings Model, or PDGM, HIPPS codes. There is a 3-day hospitalization rule in the skilled nursing facility industry where if the patient has had at least a 3 full-day stay in a hospital, then they qualify for skilled nursing facility stays. That 3-day rule does not apply to home health. So in the PDGM model, institutional credit is granted to a patient's 30-day payment anytime the patient has had an official admission to a hospital, skilled nursing facility, LTAC, rehab, or psych facility, where that official admission results in a discharge where the discharge date is within 14 days prior to the beginning of the coming 30-day payment period in home health. It's very important for you to understand that you do need to confirm that it was an official admission to the facility and, of course, have documentation to support the discharge date. On your 30-day final claims, there is the opportunity to place a code, 61 or 62, dependent on which type of facility the patient was discharged from. Acute facility, hospital, being a 61, 62, a SNF, LTAC, rehab, or psych. When placing those codes on your home health claim, you will get institutional credit for that 30-day payment period if, even if CMS or the Medicare MAC does not have a facility claim in the system that corresponds. If the 61 or 62 is not on the claim and there is not a facility claim in the system, then you will not get institutional credit. Supposedly there is a reconciliation of this process at some point where if an institutional claim shows up, then the home health agency will get credit, but you do not need to rely on that. Also understand that with the 61 or 62 being on the claim and you automatically getting institutional credit, there is going to need to be some documentation within your chart. So if there is medical review conducted on that chart, you can support with documentation it was an official admission to the facility and you have support for the discharge date. Recently, we have had many questions about the 3-day rule for SNFs and how it applies to home health. I hope this has cleared that up. I also want to reiterate that in the billing of your 30-day payment periods, in situations where the patient has already been on home health services and then they are transferred to a facility, if that patient is officially admitted to that facility, a transfer is conducted. When they come back home from that facility, if the discharge date from that facility is within 14 days prior to the beginning of the coming 30-day payment period, then they will receive, or you should receive, institutional credit for that coming 30-day claim. What you need to keep in mind is if that patient doesn't come home until into the next 30-day payment period, that patient will not, or that patient's 30-day payment period will not be granted institutional credit. So if the patient's coming home on, say, day 35, which would be into the second 30-day period, the patient would need to be discharged and readmitted to home health in order to gain that institutional credit in the HIPPS code calculation. Also, please remember that with skilled nursing, LTAC, rehab, or psych facility admissions, when a patient has already been on home health services, that in order for you to get institutional credit of any kind, regardless of the discharge date, you do have to discharge and readmit the patient. You can only get credit for institutional credit for a patient when they have been discharged from a SNF, LTAC, rehab, or psych, when it is a brand new start of care for home health. I hope this information has been helpful today. No matter how long we are in a payment system, there's always questions that come to light. If you need any assistance with your PDGM HIPPS code calculation analysis or review, please don't hesitate to reach out to Healthcare Provider Solutions. We're here to help. Have a fabulous week.